I'm Dr. Sahakian. I'm the Chief Medical Officer at Pacific Fertility Center in Los Angeles. In this next segment, I'm going to discuss in vitro fertilization. It's very important that you watch another educational video we made on egg freezing, because that's going to segue into this, and I will not repeat all the information I provided in that video. Presuming you watched that video, in vitro fertilization is basically the process of getting eggs, getting sperm, and fertilizing the eggs outside the body, hence why in vitro, which means outside the body. So in order to do that, we need eggs and we need sperm. Well, sperm is easy. Men ejaculate the sperm, we wash the sperm, and we have a sample that we can use to fertilize the eggs. The egg is a little bit more complicated. In a natural cycle, a woman produces one egg. It's not really worth doing IVF for one egg and putting yourself to a procedure of getting that one egg, which we might not even be successful in getting. Hence why when you do in vitro fertilization, your purpose is to produce as many eggs as possible to increase the chances of success. By getting many eggs, you will fertilize many eggs and you will increase the odds of getting many embryos and some more normal embryos. So when you do an egg freezing process, the way I described it in that video I produced, is you take the fertility drugs for a period of 10 to 12 days, you stimulate the ovaries to produce these eggs, and during that process you're having a couple of ultrasounds, and when the eggs are mature, eggs being contained in these follicles that we can measure, once that process is done, so you start with your period, you start the injections on the second day, you take these injections for a period of around 10 to 12 days, you get monitored by ultrasound, sometimes even blood tests, and at some point these follicles are mature and your doctor will retrieve these eggs. The egg retrieval procedure I also described, it's a 10-minute procedure. You come in, you're here for an hour and a half, then you go home and you're done. Now, that same day, we need sperm. Either your partner or husband is providing sperm, or if you're using an sperm donor, we have sperm here already from a sperm bank. We need the sperm in the IVF laboratory at the same time you have your egg retrieval. So the eggs now have been harvested and they go to the lab, and the embryologist will do the rest. So what happens in the lab when we do your egg retrieval? So the embryologist cleans the egg. Here is an egg. Now, there are two ways of fertilizing an egg. One, we call it conventional. Conventional means we take sperm, wash the sperm, and we put thousands of sperm around the egg and let the sperm go in on its own. This is done when you have healthy eggs, healthy sperm in younger women, without any fear that the sperm is going to have a hard time penetrating the egg. Now, typically, as soon as one sperm penetrates the egg, there's a shield that forms and no more sperm can enter. This is called conventional fertilization. Well, we do this, as I said, in cases where we have absolutely no fear that fertilization will fail. Because if it fails, it's too late. There's really no rescue. There's another procedure we do very, very often, majority of our cases, which is called intracytoplasmic sperm injection, or ICSI. In this case, we have the egg, but the embryologist will take the sperm and identify a good-looking, healthy-looking sperm, and it will inject this sperm into the egg with a pipette. Hence why it's called intracytoplasmic sperm injection. So this is the egg, has a nucleus, and this is the cytoplasm. If you know biology, sperm is injected into the egg. That's called ICSI. It will increase the chance of fertilization so that we don't have unexpected failures. Now, let's look what happens in the laboratory the first day after the egg retrieval, or the first day of the retrieval. So eggs have been retrieved. The eggs have been injected with sperm fertilized either with ICSI or in a conventional method, and then they go into an incubator. So here is an egg. Sperm has been already injected in it. This is day 0, the day of the egg retrieval. So on day 1, we have an embryo. The embryologist can look at this embryo under a microscope, and we will know that it's fertilized. So an egg could either be fertilized or could die and not fertilize. So typically 70% of the eggs are able to be fertilized. So now you have on day 1 an embryo. If you had 10 eggs and 70% fertilized, you have 7 embryos. So these embryos stay in the incubator for several days. We typically culture them until day 7. On day 5, so let's do day 2, skip day 2, let's go to day 3. On day 3, an embryo has multiple cells, usually 6, 8, 10 cells. On day 5, usually, an embryo has reached a stage of hundreds and hundreds of cells, and this embryo now is called a blastocyst. Now, until 15, 20 years ago, maybe 15 years ago, we stopped culturing after day 3 because we didn't have the means, the media, to culture embryos further. Now, with improvements in culture media, we actually can culture embryos all the way to day 7. And day 5, day 6, and day 7 embryos can become babies. The longer you culture an embryo, the better you know how good an embryo is. It's like a horse race. If you move the finish line further, the better horses will get to the finish line. Versus on day 3, you can't evaluate an embryo as well as in day 5 or day 6. So these days, in good IVF clinics, your embryos will be cultured for 5, 6, or 7 days. At that point, you have 2 options. Well, you have 3 options. One is you can take an embryo and transfer it into the uterus. We don't do that as much anymore because for 2 reasons. We believe genetic testing of the embryos will give us more information and increases pregnancy rates. And if you're going to check this embryo genetically, you need to biopsy it. And if you biopsy it, you won't get the result for a few days, so you have to freeze the embryo. Another advantage of freezing an embryo is that if you take this embryo and transfer it into the uterus of a woman who just produced 20 eggs, the environment is not as healthy because there's so many hormones flowing all over the place. The analogy would be planting a seedling in a pot, overwatering it. So you have too much water. It has no chance of growing. And in a frozen cycle, if you freeze these embryos and you come back a month later to transfer them, you have much better controlled environment. The estrogen levels in the body is much physiologic, much more normal, and the success rates will be higher. So we do almost 100% of the time frozen embryo transfers. We don't transfer embryos fresh. So what happens when you reach day 5 or day 6 and you have a blastocyst? So now you have the option of freezing it as is, or most patients would like to get more information about that embryo, knowing if it's genetically normal, including the gender of the embryo. So what the embryologist will do is an embryo biopsy. So an embryo biopsy, and we will call it PGTA, which stands for Pre-Implantation Genetic Testing Type A, is where you take an embryo that's a blastocyst, okay, and with a pipette, you go in and take out few cells, doesn't damage the embryo, in good hands. These cells are sent to a laboratory, the DNA is amplified and tested for thousands of genetic diseases. And then a week later you get a report, and the report will say, hey, you have 8 embryos, 4 of them are abnormal. Abnormal meaning impossible for them to become a human being because genetically they're damaged. And you have 4 normal embryos, 2 boys and 2 girls. These embryos have already been frozen after biopsy. They can remain frozen forever. And then when you're ready to have a baby, and that could be as soon as the month after, you would come, you would prepare the uterus with some hormones, and you would pick an embryo and transfer it into the uterus. So embryos have been frozen, you have the report, and you know you have several normal embryos, and you're ready now to have a baby. So what you would do is basically come back as soon as a month after you produce these embryos to undergo a cycle called frozen embryo transfer. In this cycle, you will take some hormones for about 3 weeks. You've already picked which embryo you want to thaw. You will come back to the office after these hormones, check that your uterus has responded well, and then we will thaw that embryo that you've picked. 2-minute procedure, no pain, under ultrasound with a little catheter. Embryo is loaded in the catheter. It's like a pap smear exam. We go into the uterus, put the embryo inside the uterus, come up, you stay here for 5 minutes, go home, rest for a few hours. That's pretty much it. So an IVF cycle these days is done to create embryos, test them and freeze them, and then in the future you come back to do frozen embryo transfer, whereby you thaw the embryo of your choice and the embryo is transferred to the uterus to get a baby. The odds of success is much, much higher today than it was decades ago or even 5 years ago because of advancement in our technology, of the type of media we use, of the procedures we do, the incubators we use, etc. It's hard to put a number on success rates because it varies. It varies with age. If you are someone who's using a 25-year-old egg donor, it's almost guaranteed you're going to have a baby. If you're 40, your odds of getting a baby, even with a normal embryo, is going to be somewhere around 40%. If you're 30, it's going to be more like 70%. So pregnancy rates vary. But nowadays, because we test the embryos genetically and because we transfer only normal embryos most of the time, although sometimes we transfer abnormal embryos, because we transfer normal embryos, we have much higher pregnancy rates, which is age-dependent and dependent on the quality of the embryo you're transferring. So this was a summary of an IVF cycle. Again, to understand it better, it's best to watch the egg freezing video that has been already made. And if you want to learn more about this process, please feel free to call the office and we'll make an appointment to meet us. Thank you.